This video will cover the steps on how to properly document a patient's home medications in OneChart. Proper documentation of home medications upon the patient's arrival to the facility is key in alerting other care providers on what medications or supplements the patient is taking. Documenting the patient's home medications is also needed to be done prior to the physician being able to complete the patient's admission medication reconciliation. For many areas, the medication history is completed by our pharmacy technicians. However, there are certain areas or situations that may require the medication history to be documented by nursing staff. For instance, medication histories are documented by our preoperative nurses for patients that are scheduled for day surgery. To complete a patient's home medications, you will need to ensure that you have the correct patient chart and FIN number selected for the current encounter. This can be done by verifying the information in the patient's banner bar. Start by selecting the medication list from your menu options. To identify if a medication history has been performed for your patient, you can look at the reconciliation status icons located near the top right-hand corner of your screen. An icon showing an exclamation point in a blue circle will display for patients that do not have a medication history documented yet for the selected encounter. To chart home meds, select the Document Medication by History button located below the banner bar. A new window will open. If the patient is not taking any medications or supplements, you may select the No Known Home Medications option at the top of the screen. If the patient is incoherent or intubated, selecting the Unable to Obtain Information checkbox is appropriate. Selecting the External Prescription History button at the top of the window may be useful when documenting home meds. This will pull in medication data from participating pharmacies for your patient. A patient consent to obtain the prescription history window will open next. This request states that the consent was obtained using the Notice of Privacy Practices to ensure HIPAA compliance. Selecting the Consent Granted option will start the process. A listing of medications from the search will display next. Again, this information may not be available for every patient, and any medications listed will still need to be verified by the patient or caregiver. Any past medications charted for the patient will be displayed. You may start reviewing the patient's home meds using those listed. If a patient has completed a medication, such as a Z-Pak prescribed to them a few months ago, right-click on the name of the medication and select Complete. Any durable medical equipment, such as test strips or lancets, should also be marked as complete as they are not considered to be home meds. Any medications that the patient has stopped taking should also be marked as complete. Please note that if a patient has stopped a medication within the last 30 days due to extenuating circumstances but intends to restart, you will not complete the medication. Instead, you will need to update the compliance information. To do this, right-click on the name of the medication and select Add Modify Compliance. Be sure to update the compliance status to Not Taking. Enter in the reason for temporarily stopping the medication, such as being temporarily unavailable to afford the medication. Remember to enter in the date of when the patient last took the medication. To begin entering in home meds, select the Add button located in the top left-hand corner. You can search for a medication by entering all or part of the name in the search field. When entering in medications, the best rule of thumb is to document the med by using the exact name the patient tells you. Do not convert a generic to a brand name or vice versa on your own. Note that there are several options for each drug, including selections with dosing strengths attached. If possible, choose the selection without instructions listed. You can enter that information next. Once you select the name of the medication, it will show up on the home medication list in the background. You can then fill in the details for the medication on the bottom half of the screen without closing the search box. When you begin to fill in the details, PowerChart will suggest a few of the most popular selections, and you may select the appropriate option based on what the patient is taking. After you complete the details for a medication, switch to the Compliance tab. Select the proper information source and enter last dose information. If the information was not obtained from the patient, additional details should be documented in the compliance comments section. When you have finished details for one medication, move your cursor to the search box and begin typing the name of the next medication. Remember to fill in the details for each med. Well, so far so good, right? It does help when your patient knows both the name and strength of their medications. But what happens when they only know the name of their medication? When a patient only knows the name of the medication, it is best to leave the strength blank and then enter in the information they do know in the special instructions section. This will require the physician to determine what strength the patient should be given if they decide to continue the medication. In this example, the patient states that they are taking a B vitamin. If possible, ask the patient to identify which B vitamin they are taking, such as vitamin B6. Start by entering in the name of the vitamin in the search window. Select the most generic option listed, leave the dose blank, and then enter in the number of tabs the patient is taking in the special instructions section. Okay, that makes sense. But what should I do when my patient doesn't even know the name of their medication? When your patient does not know the medication name, you can document the med by using the miscellaneous medication option and entering in the information you are able to obtain in the details. You can also follow these same steps for medications that you are unable to find using the search catalog. For these medications, start by typing in miscellaneous med in the search field. Note: you will need to spell miscellaneous using MISC when using this option. Enter in See Instructions in the dose field. Type the name or medication type in the drug name. Enter in any directions in the special instructions field. If possible, list the prescribing doctor and the pharmacy they have the prescription filled at. The pharmacy staff can use this information to contact the pharmacy to identify the actual medication the patient is taking. Change the status to Investigating in the Compliance tab, and remember to document when the patient's last dose was. After gathering the patient's home meds, verify the pharmacy or pharmacies the patient routinely uses. To do this, select the Patient Pharmacy button at the top of the screen. A new window will open displaying any pharmacies documented for the patient. If there are no pharmacies listed, you can search for and add pharmacies by entering in the appropriate information. To indicate the patient's preferred pharmacy, simply right-click on the name and select Preferred Pharmacy. If the patient has more than one pharmacy listed in the chart, you can choose to identify which pharmacy they use more frequently by right-clicking on the name and selecting the Set as Default option. If you are unable to gather a complete medication history, or if there are prescribed medications that need further information obtained, such as identifying what blood pressure medication the patient is taking, you may select the option to leave med history incomplete, finish later. Add a communication entry alerting pharmacy staff that additional information is needed and what they need to follow up on. When you are finished documenting all medications, click Document History to save the home medication list. Once home meds have been documented, the meds history status will show a green check mark. This completes the training on how to document a patient's home medications. As a reminder, you may refer to these training videos at any time by viewing them on the OneChart Nursing Space on the source, through My Learning, or by referring to the job aids available through Learning Live.